Welcome to Concussion Talk Podcast. This is episode 116, and I'm Nick Mercer, along with Dr. Shaun Kornfeld of Plasticity Centers in Littleton, Colorado, but they're also all over the U.S. But we'll talk in a second. First, I just want to remind everybody to please check out my new website, thanks to Pod Pages, and I'm now hosting this on Acast. And please visit my Patreon page or donate to my Acast page. And please follow me on social media at Concussion Talk, which is Facebook, Twitter, and Instagram, all at Concussion Talk. And now I'll just pause a word from my sponsor, my HeadCheck Health. Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. Okay, so Dr. Kornfeld, please, thanks so much for doing this podcast, and can you please just introduce yourself first?
Absolutely. Well, thank you. First off, thank you, Nick, and Concussion Talk podcast as well for having us on here. We really appreciate it and really value the opportunity to be able to kind of share with, you as well as other individuals as to what we do and some of the resources available, that are out there for people who have had brain injuries and concussions as well. So my name is Dr. Shaun Kornfeld. I am a functional neurologist here in Colorado. What that means is basically we look at the brain from a functional perspective instead of a structural perspective. So we'll touch on that a little bit more, but a little bit about me. I was born in Washington, D.C., and then grew up in South Florida by like Miami, Boca Raton area. And currently I'm living in Denver. I just moved here about a little less than a year ago, and it's been great here so far. I graduated from Florida State University in Tallahassee, Florida. And then I also went to Palmer Chiropractic School for my doctorate, and then also did a lot of postdoctorate coursework and fellows and diplomates and things like that allow me to specialize in the field of functional neurology as well.
Well, Palmer, actually, I have two friends actually went to Palmer, both from my hometown, St. John's, Newfoundland. I don't know if we can talk after Don in now, but anyway, they both. Well, one works in the U.S., one works in Colombia, I believe, and yeah. So now, we're talking about the plasticity centers. So just define what is plasticity and what is functional neurology. I'm not sure which one you want to tackle first, but they kind of go hand in hand. So I guess just come on, let yourself functional neurology and plasticity. What are they?
Sure. Right. So functional neurology is kind of a scope or specialty in healthcare that allows us to look at the brain from a functional perspective. So what does that mean? When we look at different types of imaging and different types of studies done on the brain, like MRIs or CT scans, those are all looking at the structure of the brain. Are there any tumors? Are there plaquing? Is there brain bleeds that are going on? What functional neurologists do is we look at the connectivity between the different regions of the brain, as well as how the specific regions are working as well. So we operate outside of the structural, confines, where we see a lot of people who have had structural injuries like strokes or concussions, and then have gone through the traditional medical system and have gotten treatment to, ensure that that they're able to not have any fear of life-threatening issues. But after that, they're left with what are some things that they can do to improve their quality of life. So that's what we really focus on, is we really focus on what areas of the brain are not working correctly due to whatever that insult was, and how can we stimulate those areas to get them to work better. So functional neurology really incorporates the principles of neuroplasticity, which is creating new connectivity or enhanced or efficient connectivity within the brain. The easiest example of neuroplasticity is somebody who is learning in school, or really anybody that learns throughout the day. Anytime you learn something new, you are creating neuroplasticity. So we want to use that principle and way of thinking and apply that to individuals who might have had an injury in a way that has really caused them to have symptomatology that's really impacting their quality of life. In terms of what we do at Plasticity Centers, we are a functional neurology rehabilitation clinic. We see patients from all over the world who have sought us out for our unique, highly specialized care in trying to identify what areas of the brain are dysfunctional, and then what therapies can we do to stimulate those areas as well.
So
So,
sorry, go ahead. You go.
go ahead.
I would say, how do you decide which, or not decide, but discover which regions of the brain is not working properly?
So here at Plasticity Centers, we've invested over millions rather of dollars in our technology, and that really allows us to pinpoint what areas of the brain are involved. So the very first session or evaluation that we have with a patient or client, we're basically putting them through a series of tests. It's about 2 to 3 hours long, and we're looking at different ways that the brain interacts with the environment. So we have balance testing, we have different ways to look at your eye movements, we have cognitive testing as well, so evaluating your memory and concentration and processing speed. And that really builds a picture for us, or adds up pieces of the puzzle for us to allow us to look at what areas of the brain are involved. So as an example, we have your eye movements, for example. We know that if your eye movements are not accurate, if they're not landing on the target like they're supposed to, then we know that that's a particular region of the brain that's involved with that function. And we're able to use that and pinpoint that along with our other testing to see if that's the area that we really want to work on.
So do you like grade? So say someone has difficulty with balance and their memory is like off for some reason. Do you grade like the different movement and brain balance and brain and memory and I don't know what particular value you test? Do you grade those and decide, okay, let's try this region? Like, how does that work?
That's a good question. We don't really grade things. The way that we really want to prioritize the areas that we want to work on are based on the patient's goals. So the very first thing we do when patients come in for an evaluation is we ask them, what can we do for you and what can we help you with? Some patients want to recover enough where they're able to participate at a very high level of sports. Like we see a lot of professional athletes, for example, and they want to get back to being able to play in the NFL or the NHL. Other people want to get better enough to be able to go back to work, or whatever else it may be. So their goals really help us and dictate what areas we want to focus on based on what they're hoping to achieve from care as well.
Okay, so say so the where are the plasticity centers, the clinics, your clinics in the
We have
U.S.?
locations right now currently in Denver, Colorado, Atlanta, Georgia, and then Orlando, Florida.
Okay, and you were and okay, no, and you're in Colorado now. I know you're from away from DC, but you live in Florida. You're in Colorado now. What would you, I mean, those are tests, and you also have, if we said, technology to measure, to assess people, to assess the function of the brain. But what would you do? What is your role in it?
I'm one of the lead doctors here at the Colorado Center. So my role is to basically perform evaluations and ensure that we are achieving maximum treatment outcomes based on the types of conditions and types of people that we're seeing here at the center. I will also participate in treatment sessions as well as diagnostic sessions, which is that evaluation that we were talking about
Yeah.
with all of the equipment. And basically really anything else that patients need. What we really try to do here at all of our centers is really ensure that the patient has access to the doctor. So we really want to make sure that the patient spends quality time with the doctor and that the doctor is able to answer all of the questions that the patients have. On average, our patients have been to about 8 different doctors before coming to see us.
Oh,
So
wow.
they have a lot of questions, as to what's going on and how we're helping and what they can expect. And we really make it a point to ensure that they have access to the doctor to get those questions answered and not only leave here feeling better, but leave here feeling validated and feeling like they know exactly what's going on.
And so you and I guess all your good colleagues see it only at the clinic. Is only brain injury, concussion, every like that's only your main issue. I'd say only like isn't it, but it's the focus of your clinic is brain injury, concussion, stroke.
Our bread and butter is concussion in particular. We do see a lot of brain injuries, traumatic brain injuries. Individuals who have been in comas and things like that. We also do see a lot of developmental disorders. So we see a lot of kids with autism spectrum disorder, a lot of kids with cerebral palsy as well. And we do see, other types of brain injuries like strokes. And we also actually see degenerative diseases like Parkinson's and beginning stages of Alzheimer's. We can also look at autoimmune conditions like multiple sclerosis as well.
And can you just talk a bit more about neuroplasticity? So it's not just because of course now I know this area pretty well, but because of just experience. But it's not just relearning what you could do before injury. It's also just it's learning again, not learning again, but a new learning a new way of learning. So can you just talk about that for a second?
Right, absolutely. Different patients will present with different mechanisms and needs in terms of how to best address, what's going on with that individual. So most cases, particularly brain injuries, we're looking to see not only are there ways that we can relearn some of these things, but are there different regions of the brain that are able to compensate and adapt for some of the areas that have been impacted by the injury. So your brain has the ability to rewire itself, which is really what
Yeah.
neuroplasticity is, to rewire itself and allow other regions of the brain to pick up new functions. And that's something, sometimes we have to incorporate that into our treatment plan, depending on the specific condition or injury. Other times, it's just a matter of recalibrating different areas in the brain. So sometimes we see that, as an example, different sensory systems are not telling the brain the same thing. So your eyes are telling your brain something different than your muscle feedback from your neck is telling your brain. And that's telling your brain something different than your motion system, the system responsible for perceiving motion. And when you don't have the different systems saying the same thing, your brain can get confused and become symptomatic as a result of that. So sometimes it's just a question of recalibrating those different systems so that they're all telling your brain the same thing.
Okay, so yeah, so it's because I know obviously because I had to learn a lot of stuff from my I had a severe brain injury, but I had to relearn a lot of stuff. That's the same way, it's just different kind of way of learning it. And of course, your understanding of your when you're it depends. It all depends on what age. So you're saying you had children with developmental disorders and concussion patients. So obviously you have to treat those patients very differently. So how would you describe not necessarily neuroplasticity because children are people I don't really care what that word means, but but how would you describe what you're trying to do to help them to say the difference between say telling a child that you want to help them to what you want to do to say a concussed 30-year-old?
Yeah, that's a very great question. That's one that we get from parents all the time. I would say the main difference in the approach is when you have somebody who has some sort of injury. What you're trying to do is you're trying to get that individual back to where they were before. So, in other words, you're trying to rebuild, those parts of the brain. With with a child with a developmental delay or disorder, takes like somebody on the spectrum. You're not trying to rebuild anymore. What you're trying to do is you're trying to build something from scratch that was never really there, or not neurotypical in the way that it's supposed to be functioning. So that's really the main difference. Is with injuries, you're taking something that was neurotypical and it got injured, and now you have to rebuild or recalibrate. Whereas with developmental disorders, you really need to focus on building from the ground up. And what that results in is basically we see injuries, typically more so concussions, more of these mild traumatic brain injuries. We see those recover a lot quicker than we do, developmental disorders. The developmental disorders, we're looking at more of a marathon as opposed to a sprint.
Right. I was going, yeah. And so, kind of along those lines, I guess finally, how would you say would you talk to say like a 30-year-old with concussion and like an 8-year-old with concussion, and they're displaying the same type of say it just says make it easier, just the same symptoms. So what would you say to an 8-year-old you wouldn't say to a 30-year-old or vice versa?
Right. So my approach that I like to take is with kids, I really like to gamify everything that we're doing. So I
Right.
like to make it applicable to them, and I like to make them interested in what we're doing as well. And there's actually research that shows that if you're more interested in what you're doing, you'll actually build that connectivity quicker. So what we do with kids a lot is we say things like, "Hey, we're going to help you be able to move your eyes better." That's going to be really helpful for when you play soccer or basketball or
Yeah.
whatever their favorite sport is. So we'll ask them, typically before, what kind of sports do they like to play, or do they like to do dance or cheerleading or whatever it may be.
Like video games? Are they?
Video games is huge right now.
Yeah.
With the explosion that we're seeing of how that's more and more mainstream.
Yeah.
So even video games is a great example as well. Hey, do you want to be able to be better at your game, or is there a level that you're stuck at? Well, this is
Yeah.
something that's really going to help you by
Yeah.
being able to, on the adult side, we're able to increase coordination and things like that. So those are some of the things that we're trying to do behind the scenes. But with kids, we're really relating it to games or video games or soccer or basketball or whatever it is. With an
Oh,
adult, it's a little bit more, um, more direct. We
yeah.
can really tell them and get into more of the science behind everything and show them, before and after results and those types of things as well.
So for I finally before, but I mean now this time I guess it's more so. But you personally, how many patients do you see with concussion, or not how many, but like percentage wise, and have you yourself ever had a concussion?
I would say, it's hard to put a number on it. I would say we probably see about 60 to 70% of our patient population are coming in for concussions. Most of them have had, multiple concussions, anywhere from one. We've seen people that have had up to, 15 diagnosed concussions. They might have had even more undiagnosed.
Wow.
So, a majority of the patients that we're seeing are definitely concussion. Um, and, with that, we're able to see on average about a 50% reduction in their symptoms within about 5 days.
Okay, and have you yourself ever had a concussion?
I haven't had a diagnosed concussion, but I was a very avid basketball player back in high school and college and even graduate school as well. So I would be very surprised if I haven't had one, but I haven't had anything diagnosed and no significant lingering symptoms that I'm aware of. But I definitely have had friends and family that have had
Yeah.
concussions, and after seeing so many patients with them, I really empathize with what everybody's going through and kind of where we're at now with healthcare as well for not only concussions but other brain injuries. It's just definitely something that we need to further expand our knowledge on and just continue pushing forward to really be able to provide better solutions for everybody as well.
Yeah. So how would functionology complement or be a part of any therapy regime for somebody recovering from concussion? So how does it complement, say, occupational therapy or physical therapy or speech therapy?
That's a great question. What I would say is, when you have an initial injury or trauma, you definitely want to go to, the emergency room or the hospital, and definitely rule out anything life-threatening or serious, like a brain bleed or a hemorrhage or anything that could be really life-threatening. After that, typically most people who have concussions, they're told to go home and rest. And that is what you should do, but just for a much shorter period of time than what most people recommend. Your brain should be able to adapt to that injury within about 1 to 2 weeks. So we should start to feel better by then. And if we're not, that's where we may need to do some active rehabilitation. So in terms of where we can come into play, when we look at how the brain develops, there's basically 6 stages that occur. PT, OT, and speech as well typically will work on the last 3 stages in terms of brain function and the order in which your brain develops. We, as functional neurologists, really focus on the bottom or the first 3, steps to brain rehabilitation or brain development. So those are being able to perceive the environment and gravity appropriately. It's having proper blood flow throughout your body and your brain. It's also having appropriate reflexes and absence of primitive reflexes or some of these reflexes that you should not have as you go into your kid, teen, and adult years as well. So in terms of where we fit in with the healthcare paradigm, I would say if you were told to go home and rest, and after about 2 weeks you are not noticing an improvement in your symptoms, that's where I would really think we would really excel at stepping in and being able to help people accelerate that recovery.
I've asked a lot of questions after my finally, quote unquote, but I guess so. Now, in conclusion, are there any are there any methods or devices that plasticity centers that are new or that you're very excited to share with us?
Absolutely. I have 2 right off the bat, or actually 3 that I can think of. The first one is that we have what's called a multi-axis rotational chair. It's called MARC for short. And this is a vestibular rehab chair where we're able to put patients into the chair, and we're able to
Is that
either
on your
basically,
webpage? Is that the
yeah,
one
yeah,
on your
exactly.
webpage? Okay. Sorry, go ahead.
Yep. Yeah, so that basically allows us to perform vestibular rehabilitation with patients, but in a 3D dimensional plane or 3D landscape, which is really how your brain works. So instead of just being limited to different types of head movements or some single plane body movements, we're able to flip patients forward or backward. We're able to rotate them. We're able to roll them as well, side to side. And all 3 of those movements are going to work on different types of receptors in your brain. So that's really a cool piece of technology because that allows us to stimulate some of these different receptors that might not have been stimulated without the use of that technology. The second one that I'd like to share is what's called video oculography. These are goggles that that a patient would wear on their face, and it has infrared cameras in them that allow us to look at your eyes. But it allows us to look at your eyes when you're not able to focus on anything, or you're not able to have any light to fixate on. And that's where a lot of your aberrant or abnormal eye movements will come out. Excuse me. So we'll see patients, for example, that come in following a concussion that have vertigo or dizziness. And when you look at their eyes without that device, you'll see that their eyes are nice and still. But when you put that device on and you remove the light or their ability to fixate, you'll see maybe a drift of their eyes, or you'll see some spontaneous abnormal movements of their eyes. And those are things that are really, really vital for us to show that there are areas that are dysfunctional in the brain that you're not able to pick up or see without infrared equipment like the VOG or video oculography.
And
And
do you use those in the clinic, in those your specific clinic room, or is there a certain room or place you have to put those on?
So those are going to be in our office, and we have them at all of our locations. And basically, that's part of that evaluation that we would do that first day. It's part of the eye movement evaluation where we look at your eyes in the light, in the dark, if they're still, if they're moving, if they're tracking as well. So that is definitely something that we need to do in office. That way we're able to utilize that equipment. And
Oh,
then the
sorry.
third thing that
It's called, sorry, I don't know,
Yep.
your third one, but it's called video oncology, the video
Video oculography. So
photography.
it's basically VOG for short.
Okay.
But if you look at the word video means, eye recording or recording. Oculo is eyes, and then graphy means to measure. So it basically is using video to measure your eyes is kind of how it
Okay.
translates out.
Yeah. Okay. Sorry. Continue. The
Oh, yeah,
third,
absolutely.
third.
Yeah, no problem. Yeah, the last piece that I just wanted, I think would be beneficial to highlight is our hyperbaric oxygen chambers as well. So we have hyperbaric oxygen therapy offered as a service here at our centers as well. That is a really cool up and coming piece of technology or service or treatment that we can use for individuals who have had concussions or brain injuries. And basically what that does is that's going to dissolve oxygen directly into the plasma of the blood, which allows not only, first off, it allows a lot of oxygen to reach the blood or the brain, which is going to really increase fuel production and energy levels in the brain so that they can better respond to all of the treatment that we do. And then if you do, a certain number of sessions, 15, 20, 30 sessions, you can start to see different types of effects happen, like anti-inflammation. You can even see stem cell proliferation or stem cell generation as well, and blood vessel dilation or more blood flow to these areas too. So that's something that's pretty unique to what we have or to what we can offer. And then in Denver specifically, we have a hard-sided chamber, so we're able to go to a much higher pressure and higher oxygen concentration as well. I want to say we're the only private practice, at least in the Denver metro area, that's able to offer that.
Okay. Wow. So is Denver your biggest office, or is that Florida?
Well, we started in Orlando. So we started there in 2015. So right now they're seeing more patients. I would say they see the most amount of patients. But we also have Denver and Atlanta that we acquired back in 2020, and those are all rapidly growing as well. So, what we really are trying to do is we're really trying to build a network of different centers where we're able to receive, or patients are able to receive the same standard of care no matter which location they go to, same technology, same standard of care, same expertise. That way, patients who are struggling with symptoms don't have to worry about traveling to come and see us. They can just go to their center in their city and be able to receive the care that they need without having to go on an airplane or a train or whatever else it may be. So we're obviously not quite there yet, but that's kind of our overall goal. We really don't want to have to add that added layer of travel, for our patients. It's just something that we don't want them to have to deal with.
Yes, I guess they yeah, you see different patients in Denver that lost ski accidents. They wouldn't say Orlando. Who wouldn't say many ski accidents in Orlando. They wouldn't never that. So it's the same, but it's the same. It's the same injury, and it's could be taken seriously, and you got to treat it as well as you can. So yeah.
Yeah, I
So
agree.
thank. Sorry. Sorry.
I was just gonna say, yeah, I agree. I mean, we see, here in Colorado, a lot of snowboarder, skier, things like
Yeah.
that. Orlando, more Florida types of activities, uh, boats and water skiing, things of that nature. So yeah, it definitely varies depending on the geography.
Right. Okay. Well, thank you so much, Dr. Kornfeld. I think I heard you Cornfield earlier. I meant to say
That's
Kornfeld,
okay.
but so thank you very much. And yes, and is there anything else before I let you go there? Anything else about the Plasticity Centers where people can find you online or in social media, or you personally, for if you want to say.
Yeah, absolutely. And first off, with my last name, everybody messes it up, so don't worry about it. But yeah, in terms of being able to locate us, plasticitycenters.com is going to be our website. You can also reach us at, let me just see here.
Yep.
So you can reach us by phone at 855-955-9727. And you can also find us on all different types of social media, Facebook, Instagram, YouTube as well. And then one thing I just wanted to let your audience members know, we really are looking to help people and really get them feeling as good as possible. So we do want to extend, a free phone consultation to patients or potential patients that are looking for answers and help out there. You're able to speak with a doctor, for a reasonable amount of time, and we're really able to help you kind of decide what could be the next step. Is this something that works for you? Is there something else that might be worthwhile as well? But we really just want to do our part and really try to help, people that are in need.
That's great though. Thank you so much. And it's been great talking to you. And do you name the at so for Facebook and Twitter, Facebook and Twitter and YouTube and Instagram, it's at Plasticity Doctors, DR, okay, at
Yep.
Plasticity DRS, or I think
Yeah, exactly. Our
by then,
Instagram is at plasticity doctors. Yeah, at plasticity doctors.
okay, and that's short for doctors, isn't this? I mean, but yeah. So thank you so much, and thank you all everybody for listening, and hope you're listening again soon. And I think Blackfield will have a new podcast out next week. So thank you again. Music at the beginning of this podcast is by Ben Sound. www.bensound.com.